Hi there to everyone. Hi to all my patients. Just to introduce myself, my name is Glafkos Tomboulis. I'm the owner of Ethicare Dental, and this will be the first in a series of videos covering a range of subjects. So the first of these videos is just to let you know what I've been up to in my self-isolation, what we've been doing at home, what's been going on in the dental world at the moment, and how we're dealing and managing with patients in the current climate. So up until early to mid-March, we were largely unaffected, but things moved very fast at that point, and we closed the practice around mid-March. And whilst being at home, been very busy putting things in place to look after the business going forward, taking advantage of many of the government schemes, many of the initiatives which they've put in place, but also keeping a close track of all the developments in dentistry. Initially, there were lots of different policy changes from NHS England. And in coordination with that, there was lots of advice coming out from NHS Scotland and NHS Ireland, and also information coming out from the British Dental Association. And so it was quite a confusing time for us in terms of what we should be doing, how we should be managing patients, and who we should be treating, what kind of procedures that we should be carrying out. Eventually, clarity was achieved. We were informed as dentists that we should no longer be seeing patients, whether it be for routine treatments or indeed seeing patients face-to-face for emergencies. So at the moment we're communicating with patients via text message, via phone, via email, and also potentially via video conferencing. Well, obviously we can't carry out routine treatments, we can't carry out face-to-face treatments, so what can we do? So for patients who have got emergencies, just give me a call or make contact with the practice via email. The details are on the web page. It's smile@ethicaredental.co.uk. And I'll be able to help you with any dental emergencies. And the kind of help that I can give you would be through advice in order to manage the emergency that you're dealing with. I can give you advice with regard what kind of analgesic would be most effective, the amount in relation to any other medical condition that you might have, but also potentially if there is something infective going on, prescribing you the appropriate antibiotics, and we can work together with your local pharmacy to be able to provide you with that antibiotic. For patients who need face-to-face treatment, NHS England are setting up acute dental emergency centres in the hospitals around London. Again, the first port of call would be to contact me. I'd speak to you on the phone. If you're not responding to the advice or the analgesia or the antibiotics, or I feel that your situation is not going to be one of those things that can be treated with any of those things, then it may be appropriate that we need to refer you to one of those centres. As I say, give me a call first. They're not walk-in centres. And then at that point, I would tell you exactly what to do in order to be able to go forward with initiate that process. So as well as making these videos, I've been updating the website on a regular basis. I've been sending far too many emails, so my apologies for that. And if you feel as if you've been inundated, it's only because I'm just trying to keep you informed and keep you updated with everything that's going on with the practice, probably as a result of having too much time on my hands, so apologies for that. But I'm going to be making a series of videos which I'll be posting here and to our other social media, and those videos that I'll be making will be examples of which will be dealing with different types of dental emergency, cosmetic treatments which are available, which again we won't be able to provide now, but other kind of things that we do at the practice. Good oral hygiene at this time, how to go about brushing your teeth, flossing, using little brushes, things like that. Also hygiene for orthodontic patients, how to use home whitening trays and to load up home whitening trays, and also pieces of dietary advice, specifically advice tailored towards patients who suffer from acid erosion. So if that's anything that you are interested in, get ready for it, because that's coming your way over the next week or two. Thank you very much.